big implication for us in the quality payment program rules for 2025 is the requirement that 100% of our ACO participants need to be on certified electronic health record technology, also known as CEHRT.
You're right, David. That has a big implication for all ACOs. As a reminder for all of you, before the 2025 reporting year, ACOs that were advanced APMs had a contract requirement that 75% of their participants were using certified electronic health record technology, CEHRT. ACOs that were MIPS APMs had a 50% use requirement. Now, starting in 2025, both groups are contractually required to have a 100% certified health record technology utilization. And all providers are also required to submit a promoting interoperability MIPS performance category submission. No question, this is hard and may force some practices to leave ACOs or ACOs to reject some practices. Now, there are some other factors remediating that new ruling that fall under the categories of good news and bad news. So let's walk through those. First, good news. The exceptions that have always existed for CEHRT use, as evidenced by promoting interoperability, equally apply now to the ACO requirement. So despite the 100% utilization requirement, all of the exceptions still in force year by year apply equally to ACO use of CEHRT as they do for MIPS CEHRT use requirements. So both automatic exceptions and exceptions granted on hardship application apply. Things like small practices, having 15 or fewer providers in the practice, non-patient facing practices or providers, facility-based providers. Now, hospital-based and ambulatory surgical center-based providers should be automatic, unless, of course, they divide their efforts between multiple facilities. But if you don't fit the automatic exception, if you're facility based, and for others, you can make a hardship application, and those are typically readily accepted. And so, if you're accepted for a hardship application or have something automatic, you're also exempt from the use of CEHRT in ACOs. Now, second, bad news. The final rule for 2025 cues for the 2027 performance year, so that's looking ahead 2 years, sunset of the MIPS CQM option for the APP or APP Plus reporting. If this is not modified before then, and I'm going to continue to lobby for it to be changed, I think it's foolish for CMS to sunset MIPS CQMs for ACOs. It just makes it too hard without adding any value to your reporting effort. If this is unmodified by 2027, you will need to make either an eCQM submission or a Medicare CQM submission. With Medicare CQM submissions, the standard CEHRT, the certified use of EHR, all those exclusions will still apply. But eCQM utilization will effectively end the applicability of the CEHRT exclusions. You have to have CEHRT in order to make an eCQM submission. So your practices that qualify for one of the CEHRT exclusion criteria will still have to have CEHRT in order to contribute data to your APP or APP Plus quality reports. Finally, one last piece of good news. You can use the data completeness requirement to modify your CEHRT requirement. That is, data completeness requirement for this year, 2025, and next 2026 remains at 75%. It's not yet set for years after 2026. It could go up to 80% in 2027. Who knows? But whatever the data completeness requirement is, you can spend it on practices without CEHRT. With that limitation in mind, you can still have practices without CEHRT in your ACO, but only to the extent that you can still generate electronic data analysis applicable to enough of your denominator patients to be at or above the data completeness requirement. So a little bit more complex, and you don't have as much freedom to use your data completeness requirements for other things, data access issues, data transmission issues, things like that. But it's not. It can modify that CEHRT requirement. So good luck. I hope that along with me, you continue to comment to Medicare that it doesn't make sense to disallow MIPS CQMs. You should get, each of your practices should get the best possible score that reflects your actual performance and not bake in the technical requirements that are inherent to CEHRT reporting.